I was fascinated by Sherlock Holmes and the way that he thinks and sort of the mechanism by which Conan Doyle kind of made him into the consulting detective and how he discovered things by observation. I was interested in science when I was in school and decided this would be a good mechanism for me to use observational skills and be able to deduce things from facts that I learned and acquired. So I had the opportunity to meet a cardiologist who I was very fond of. We did a research project together. He was my mentor during medical school and I wanted to be a lot like him. The major symptom we see is chest pain and the major diagnosis is coronary artery disease. But we see people with high blood pressure too and valvular disease and heart muscle problems and things like that, but overwhelmingly the majority of them are coronary artery disease, which is narrowing of the arteries that supply the heart with blood. Wellstar has really developed a pretty significant preventive cardiology program, preventive atherosclerosis program, where we have dietitians, we counsel people about diet and exercise, controlling blood pressure, making sure diabetes is under good control, smoking cessation. For me, to see patients who I've had for 30 or 35 years who are still alive is really gratifying. And a patient just on Thursday who I've been taking care of for over 30 years, and it's interesting that one of his friends said to him, you really ought to think about changing cardiologists. Dr. Sacks is probably, getting really old now, and you should really think about getting someone younger. And he said, well, he kept me alive for 30 years, so why would I change?